Well done, everybody. That's on time. And today we're gonna, oh, wait a minute, something's not right. I'm gonna change my hairband. Wait. Damn, it was all recording. I couldn't even like do anything. Even the recorded people will know the truth about me. Well done, everyone that's on time, and everybody that's on time, they need to get some perks because, honey, like, why should the people that are late get more benefit than people that are early, right? So let's quickly get started so that people miss and then they feel bad. Okay, I'm so rude. I'm just being a teacher. Okay. Okay, well done. Arshi has been here on time every single day. Well done. Good girl, Arshi. Aisha's here because it's her favorite topic related to her field. Very good. Aisha's been here yesterday as well. Asma as well. Zara, I'm not talking to. I'm just kidding. I didn't see you, Zara. Why didn't I see you yesterday? Huh? I'm just kidding. Anyway, everybody has their job, so I completely understand lab 2. And some days everybody see today is a good day. You know why it's a good day? Because I decided to keep it short today. Because see, time and again, you have to give rewards to your students. And the same thing goes for you. You should also time and again give yourself a reward for going through difficult and tough exams and pathways, you know, obviously, because it's not easy to give this exam that you're giving. It's very difficult, and some days are difficult than others. But I want to encourage you all of you that maybe if you're feeling very overwhelmed, it's today. Tomorrow you're going to feel better. Tomorrow is going to be a new day. So keep that in mind whenever you're feeling overwhelmed. And secondly, is that you guys deserve some days that are easier than others, and I will make that day today is going to be that easier day. Why? Because today we're doing sexual health, and sexual health, there is handful of cases that we need to do, and it's good that you're early. I'm going to try to finish early also, so that people that are late, like, I'm so rude. But that's the truth. Anyone that's like doing well in class, I have to make sure that they feel good about doing it, right? Because what's it called? Positive reinforcement. Okay. So basically, we're doing sexual health today. In Lab 2, sexual health scenarios are not that much. Okay. Sexual health scenarios are not too many. There are few. Okay. So, however, I have squeezed in some of the gynecology in this too, and some parts of how to take a sexual history as well. So I've made it in a way that it's not too less. Okay. I hope that makes sense. Okay. Who's active? Give me some active people so I can start.
Hello.
Yay. I was like, this is my type of a topic. Who? I heard someone, Asma.
That was
Hello,
me.
Dr. Hasna.
She's like, that was me. How dare you? Okay, Arshi, I see you. I see you. My favorite. No, I can't say that out loud. Shoot, did I say that out loud? No, I'm just kidding, guys. Please tell me no one heard that. Because Arshi's been here since day one, okay? So if someone does better, someone does good, I will appreciate them. Okay, so what did we learn yesterday? We learned female health, yes. So we did yesterday, what we were doing with the female health that we were doing yesterday was we were starting from up top. I don't like doing that. I like starting from below and going up. From below and going up means in sexual health, pelvic inflammatory disease develops later. First comes from down to up. What is this called? What is this fashion called for infections? Let's see who knows the word that I'm looking for.
Ascending.
Ascending infection.
Well done, geniuses. This time my course, there's like genius people in this course. Don't tell anyone from the previous course I said this, but you guys are amazing. You're doing very good. It's like, yes, in the previous course, maybe 1 or 2, 3 people would answer the right thing, but like others would not really say the right answer. But in you guys are actually answering. So don't think that, oh my God, 5 of us are answering, that means it was easy. No, trust me, it's not easy. The things that you're answering are actually worth praising. Well done. Each one of you is doing a good job. Okay, so let's go. So we're starting from down and we're going up. And I want you all, I'm going to test all your concepts today. Okay. So if you don't have a basic concept, PLAB 2 is like, I just want to see that you should have a basic concept in order to step into a new system. So that if you step into a new system and someone asks you something, so like you keep my respect over there, okay? Because I taught you. I'm responsible for you now. Now, see, let's talk about female. And I'm gonna test your concepts as well. Not just PLAB 1, but like overall general testing or whatever, okay? Wait. Let this goes narrow. Okay. Like that. What the heck? Okay, let's zoom in. I hope everyone can see my board. No. Latecomers, please don't even talk to me. I'm done with you. I'm just kidding. I'm not kidding, actually. Moving on. I'm kidding is a way of me saying like I don't want to be rude to you, but how dare you be late? Okay, let's suppose this female genital system. Okay, I'm going to teach you about both the systems. Okay, basics. If you don't know the basics, then how can you go for the non-basics, which is like the big six? I don't know what I just said. Moving on, my point over here is if your foundation is not strong, if like we build a building, honey, if the building's foundation, the basement part where they like lay like stuff in the like underground just to make that building strong enough so that it doesn't move when like rain comes, wind comes, that foundation is a real thing. And this foundation should come to you from day one of your MBBS. But if not even then today is the day. Start over what? Okay, so I'm going to be teaching you literally like MBBS stuff. So this is the uterus. Okay, now you guys are going to label this uterus for me. This part of the female reproductive system is
Vagina.
well done. This part, let me just keep the chat open so I can see what you guys are saying. What is this? Okay. What is this part of the system?
This is
Cervix.
canal.
Aisha's like, oh, so easy, bro. What are you even asking? I'm sorry, Aisha, but for my other guy. So guys, I have to, as a sign of a good teacher is that, you keep in mind all of your students, not just one or two. I know there's some geniuses. Some people actually don't know basics, and that's not something to be embarrassed about. That's why I'm here for you. Okay, and I'm going to go with the basics so that everyone understands. Who messed up my cervix? Sorry, not like my cervix, but like you guys get what I said. Who messed this up, guys? Oh my God. Moving on. Delete this. Okay. Thank you, Seher, for the audience laughter. Love you. Okay. What is this?
This is uterus.
Very good. Okay. Now, on the sides of uterus, what are these?
Fallopian tubes.
And then
And very good.
ovaries.
Okay. Very good. Brilliant drawing. Oh my God. Okay. I wish I could do better, but that's fine. It doesn't matter how ugly you're drawing it. What matters is that there's concept behind it. Okay. Which is I'm going to create right now. Now listen very carefully. Now, I'm sure you've heard of candida, gonorrhea, you've heard chlamydia, you've heard like, pelvic inflammatory disease. Then you heard like not that, urethritis. Then you heard about like, what do you call it? Epididymoorchitis, all of these things, right? Oh, I love you, Asma. Thank you so much for that. So I'm sure you've heard a bunch of terms. Now let's organize those terms, okay? Because I understand it's not easy to like, completely get all of that, okay? And I'll be very honest with you. The only reason I'm even teaching you this, because even my time when I was going for PLAB 2, I didn't know I knew the basic things, but there were some things that always confused me. Okay. And then from the uterus, we go into the system. Okay. This is the systemic circulation. Okay. Now what happens is infection first. Who's going to tell me what is candida? What is trichomoniasis? What is vaginalis? Vaginosis? Brain fog alert. That's why I got this.
Candida is a fungal infection. And trichomoniasis is a protozoan, flagellated protozoan. And vaginosis is bacterial vaginosis.
Guys, we weren't expecting such a complex definition. That was too good, Aisha. No, 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 no. We're not doing MRCP, we're doing PLAB. Just tell me, Aisha, where do these bugs attack?
Basically, the bacterial vaginosis and candida, they are not sexually transmitted infections, and the trichomoniasis is a trichomoniasis, chlamydia, and gonorrhea. They are sexually transmitted infections. So,
Right.
candida basically, it will attack like. like, the symptoms are mainly vagina, which related candida. The discharge is thick in consistency, it's curdy, and it is associated with itching, and it's mostly related to the in diabetes, or the patients in the pregnancy, or those who have depressed immune system. And
Very good. Okay.
and
Aisha, that
the
was,
one, sorry.
yeah, keep going.
And the other trichomoniasis, they have yellowish green discharge, and it is related to um, itching. And in candidiasis and trichomoniasis, they both are related to itching. And in the 2% of the cases in trichomoniasis, you see the strawberry cervix, the red cervix is red. And the treatment in candida is clotrimazole, that is fungal, and then depending upon the recurrent infections, we can change it. And um, these are topical as well as oral treatments for the candidiasis. For the bacterial vaginosis and trichomoniasis, the metronidazole is a treatment. So
That's brilliant.
bacterial vaginosis is basically it is you have a fish, the patient will have a fish, will have a color is medorous, whitish medorous discharge, and a fishy smell. And they will be on the microscopy, you'll find the glue cells. And uh, basically, and if we'll not go into detail, these are the things for the
Yeah,
bacterial
heavy.
vaginosis. Otherwise, we should inquire
Aisha,
about. Sorry.
if you don't mind, I'm going to ask you to stop. I just wanted the answer to one question. Where do they attack? That's the only question I have. However,
Vagina.
those were very good points. Those were very good points. Exactly. That's whatever Aisha said was accurate. But I'm trying to go from basics and slowly, slowly teach and start from first tell me. Everyone, actually. So Aisha has given us beautiful explanation. Now, all of you try and tell me Candida, where does it attack? You have this
Vagina.
whole system over here.
Vagina.
The
Okay.
vaginal canal, basically, it stays there.
Well done. So that's all. So remember, we have 3 infections. This is Candida. We have vaginosis. Okay, now listen. According to PLAB 1 or even like other exams, yes, a lot of knowledge is perfect. Okay, but in PLAB 2, we just need to know basics, and that is, let's start with the basic concept of these infections, because this is too much. What is the difference between gonorrhea, then what is cervicitis, then what is candida, then what is strawberry cervix? These things come into your mind. That's what I'm trying to organize for you. Okay, first thing I want you to know, candida and vaginosis and trichomoniasis or whatever. Just remember candida and vaginosis. These 3 infections attack the lower genital part. Okay, they attack the lower genital part, the vagina area. Could be upper vagina, but mostly they stay lower. Okay, therefore they cause symptoms visible in the vagina. Okay, which means that is the discharge. Oh my god, can I? They cause what? They cause discharge. Number 1, discharge. What is the other symptom they cause? They cause itching of this vagina. Okay, there's itching. So itching is also lower, because that means something is close to the vagina area, that it's like we can it's affecting our outside area as well. You get what I'm saying? Well done, Asma. Okay, so basically, if vagina is infected, guys, I'm very sorry, my brain fog is really showing today. Coffee does the trick. Okay, I stumble upon my words. You know I'm brain fogged. And some days it's just, oh my God, I'm just too active. Like everything makes sense, but it's okay. Some days everybody has those days, and I hope you all understand. Okay, if I stumble upon my words too many times, it's because uh, not every day you can be 100%. Okay, let's go. So what happens is, just remember, number one is candida, number two is vaginosis. Give me one difference between candida and vaginosis. One difference. Name,
The
like
color of the
what's
discharge color.
no. Give me a difference between the personality of candida and the personality of vaginosis.
One is a
Vaginosis is
fungal
bacterial.
infection.
Yeah, Zara, go
Ca-
ahead.
Candida is fungal.
Exactly. The basic difference between candida and vaginosis is that candida is a fungus, which means exactly as Aisha told us, that if someone's diabetic, someone's low on immunity, candida most likely will attack you. Okay, because fungal infections usually attack people with low immunity. Okay. And then you have the vaginosis, which is caused by which bug? What is the name of the bug of vaginosis? It's known as garden.
Gardenia.
Very good, very good. She knows, she knows. Well done, Seher. Garden
Bella vagina.
doesn't matter. You don't need to know. For Plab 2, you don't need to know the name of the bug. Just for your knowledge. Okay, now we know their personalities. Okay, and then we have a third guy. You can know him if you want, but like it's not gonna come in Plab. What's his name? Plab 2. Okay, TV, strawberry cervix, as Aisha said, very good. But you won't have to deal with this. Okay, I'll just tell you one basic thing. The treatment, exactly, thank you, Aisha, that was brilliant. The treatment for the treatment for candida is, everyone remember, C for candida, C for
Clotrimazole.
brilliant, clotrimazole. This is antifungal agent. And the treatment for vaginosis and TV, even like any bacterial stuff, it's always going to be metronidazole. Exactly. So metro is a antibacterial, whereas antifungal is a clotrimazole. Okay, we get the point. We get it. Candida. Now, who's going to tell me one important thing? Are these sexually transmitted infections? Except for Aisha, anyone can answer.
Nope, they are not.
Okay, Seher thinks it's
The candida is not.
no, Candida is
Bacterial
not, but
yeah. Wait, I am just remembering.
I'm literally telling you guys the most common mistake students make during Plab 2 mocks is,
No, they are not.
what was my
They
question? I
can
forgot.
be.
Are
can.
they as like sexually transmitted or not? The candida and bacterial vaginosis.
Yeah, that's the question.
Yeah.
So, who said they're not sexually transmitted infections?
I said that.
Okay, Seher, tell me then, where do you get them from? Why do you get them? I'm sorry.
The candida is, it's a fungal infection. So whenever your immunity is low,
Okay.
then you are
Okay.
going to get the
Fine.
candida one. And
Agreed.
the second one, the bacterial vaginosis, we get this because of the imbalance of the normal flora of the vagina.
Okay.
When the people use the soaps, the female use different products.
Wow.
And
Seher, when is your exam?
November 30th.
How do you know
30th
this?
November.
How do you know this?
I've been treating patients.
Oh, we have another doctor in here.
No,
Not like that's so rude.
I'm just a medical officer. No, I'm just a medical officer.
No, same thing. Like, very good.
Yeah.
Well, okay, guys. Exactly what Seher said. Now, if you forget what I'm telling you, then there's a huge penalty on you. Okay. If you cannot forget this, because this is where everyone goes wrong in the exam. You won't even believe such a basic mistake people make is that they don't know that these are not sexually transmitted. Candida and vaginosis both are affected by soaps disturbing the vaginal pH. When the pH of the vagina is disturbed, it results in a favorable environment for these guys. You get what I'm saying? So that's why when you give soap, it becomes acidic or it becomes whatever imbalance of pH. And then like candida and vaginosis, yes, we got a chance. Okay. So this is what happens. Bubble baths. Okay. cleaning yourself down there. Okay, these are practices we need to tell ladies to stop. You're not supposed to soap yourself down there. Okay, this is something you need to tell them. Not everyone knows that. They think, oh my god, hygiene, we need to soap ourselves. No, that's it, completely wrong medically. Okay, soap, bubble baths. And one more thing is for candida, exactly, some people have low immunity. Some people have low immunity. For them, candida might also attack them. Okay, so in all cases, these are usually the reasons why someone would have an infection. Okay, so what happens is these are lower vaginal infections. Now clinically, now listen to my question. Clinically, how do you differentiate between candida vaginosis? One difference, tell me. Aisha has mentioned everything. Actually, if you guys were listening to her, you'd know the answers.
By the color of the discharge.
Very good. So candida is supposed to be
Curdy white.
Curd, like
very
curd.
good. Very good. Yogurt light, white discharge. Very easy. And any bacterial infection should be
Greenish.
exactly greenish. Okay, like okay, like okay. You know what I'm saying? Now, these are the important. Okay, now let's come to the lower vaginal infection, talk about them. The reason we don't talk about vaginal infections in STI, sexual health, is because they're not sexually transmitted. That's why we talk about these in gynae. So I've taken the topic from gynae and I've squeezed it in over here. Okay, so that we can go in order. And the second difference is about the itching. We all know in a fungal infection, there's always going to be an itching situation going on. Okay, so patient will present to you, doctor. Number one thing she'll tell you, it's embarrassing. I'm embarrassed to talk about it. The patient always, in cases of vaginal infections, they will be like, it's a little embarrassing, doctor. I don't know how to talk about it. Okay. And you're going to tell her, oh, I want you to know, as a doctor, we see many cases every day. So please don't feel that way. We are here for you. There is nothing to be embarrassed of. So you have to console her in the first part of this case. Okay. Extinguish her embarrassment in the beginning. Okay. There's no such, don't be, confidentiality is different from embarrassment. Remember that. There's a huge difference between confidentiality versus embarrassment. Relieve embarrassment. Don't be like, anything we talk about is going to remain between this medical team, and she's just embarrassed. That's a different emotion than feeling like, I don't want to tell you this. Okay, so patient has come to you and she herself will come to you. Obviously she doesn't want confidence, she just wants to, she doesn't know how to speak about it. So you say, who would like to open their mic and try to relieve the embarrassment? We'll try
I
to
can
finish
try.
early. Yeah, go ahead.
Okay, what's your name?
Alexa, whatever.
Hello,
Hi.
I'm Dr. Vaseem and I'm one of the junior doctors at this department today. Are you Alex?
Yes, doctor.
Could you confirm your age for me, please?
I'm 30 years old.
Okay, Alex, tell me, how can I help you today?
Yeah, doctor, actually, I don't know. I'm a little embarrassed about the whole situation.
Oh, okay. Please don't be embarrassed, Alex. I'm a doctor, and us as doctors, we see all sorts of cases every day. We meet and treat all sorts of patients every day. So there's nothing to be embarrassed about. This is a safe space. Please speak to us.
Very good. See, look at Arshi. She always says something new. She never ever like copies anything I say. That's what I love. So keep it original. Make your own script and don't even like copy Arshi's script. That's Arshi's, okay? Like this is a safe space. Very good. Brilliant. Okay. Anything you guys can recall, keep it like that. And Asma is asking me to repeat about the itching. Asma, I'm just saying the itching is also a difference between a clinical difference between candida and what's the name? Vaginosis, is that fungal infection always causes itch. So candida will always cause itch and white discharge. Got it? Now, so you first relieve her embarrassment, then you go for the exact structure I taught you guys. Complaint, and what did I say for the history of discharges? Track history. So you can ask her, okay, tell me, you had a doctor, actually, I'm having this really foul smelling discharge and oh, I feel so bad about it. Okay, so you're going to ask her, could you tell me when it started? Doctor, it's been a month now. Okay. And could you tell me what color is the discharge? Obviously, these are the questions you're going to ask. Doctor, it looks like it's about like greenish yellow. Okay. Now we all know it can be. Have you noticed any itching with the discharge? No. No, I haven't noticed any itching. Sorry, I just had a brain fog moment. Anyway, what do you mean no itching? Yeah, no itching. Okay. So then you inquire about whatever you want. Who's going to tell me what red flag you need to inquire about over here?
Fever,
Brilliant. What are you thinking, Seher?
infection.
Well done. You should always, the red flag for such infections is always PID. If it's gone to PID, that's not a good sign. That's actually a bad thing. PID is not a simple infection. PID only happens when someone's been too far. Like your infection has been so bad that it's entered your pelvis and now it's going to destroying your pelvic organs, leading to infertility. You know what I'm saying? So it's a very bad thing to have PID, right? So PID is a red flag and PID is not a good thing. So don't just consider PID as a simple pelvic inflammatory infection. No, PID is a serious thing. Maybe we didn't know that before. Now we know. Okay. So fever. Have you noticed any fever with this? No, doctor. Have you noticed any tummy pain? Very important. No, 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 not tummy. So this is good. We all know it's a localized, it's down there. Okay, it's not going up anywhere. Okay, so it's not an ascending thing, it's just down there. The discharge is the only problem, no itching. Okay, you can ask how much is the amount of the discharge if you'd like to ask that. Doctor, it's a lot. So you know it's like, okay, if it's a lot, 100% it's an infection, can be a normal discharge. Okay, very good. The rest of the thing you can ask like PMAF-TOSA, but once again, what did I say? Keep it relevant. So in this case, you have to do two types of history should be your important histories here. Who's going to tell me what are the two types of history that are important over
Sexual
here?
history and menstrual history.
Very good. Sexual and gynecological histories should be taken. Where is my beautiful structure? Here we are. So we all know PMAF-TOSA, yes, we'll ask, but like in the PMAF-TOSA, we can ask about, I think more relevant to ask, family history makes no sense to be asked about in discharge, makes no sense. I will ask her long-term medical condition, what if she's diabetic? Medication she's on, what if she's on steroids? These are relevant questions. And then I'll proceed to gynae history. This is how you save your time. 3 minutes, 30 seconds. You don't have time to ask about family history, allergy. Did you travel? You traveled. So what? I traveled. What's your issue? Okay. So like, don't ask lame things. Ask important things, relevant things. Okay. Coming to special question, the two special histories you're going to add over here is the gynae history. Let's take the structure over there. So every time with a vaginal discharge situation, add on two histories. Always, guys, remember, gynae plus sexual. How do you take a gynae history? I taught you guys yesterday. Who's going to tell me the main questions of a gynae history?
When was your last menstrual period?
Brilliant.
Are your
LMP, first.
Are your periods regular or not?
Brilliant.
Do you bleed heavily when you do get your period?
Very
And
good.
are you using any form of contraception?
Brilliant. Okay, these are the four main questions related to your gynecological history. If someone wasn't here yesterday, then number one, LMP. Number two, assess about her cycle. Is it regular? There's a difference between saying, is your cycle normal? That makes no sense. The actual two things we need to assess about the cycle, is it number one, regular? Is it coming after 28 days? Or is it coming after 2 months? And then three, that's not a regular. So you need to assess the regularity. Then you assess, okay, while you're on your period, do you have heavy bleeding? So menorrhagia is a different thing from regularity of the cycle. Keep that in mind. Okay. Have you had any kind of maybe heavy bleeding? So you can ask this. And fourthly, you can even ask about dysmenorrhea during this. And fourthly, you should ask about, are you taking any type of contraception? Why are we assessing contraception in a case where there's discharge? I wonder why. Who's going to tell me?
Any intrauterine device can cause
Yeah.
infection because it can cause PID. You told us yesterday.
Well done, well done. Even Seher's like, yeah, I was about to say the same thing. Well done, Seher. So, I understand that maybe someone says it first, but like I will always appreciate both the people. I have good psychological knowledge. So I know that Seher was about to say the same thing. So well done, Arshi and Seher for that. Okay. So exactly. I forgot what we were talking about. Completely forgot.
Gynecological history.
We
What?
just discussed about the PID.
Yeah. Thank you. So contraceptives you asked because you're like, honey, are you using any contraceptive? Yes, doctor, I'm using IUCD, and you know it's like a PID for sure. Okay, so but in this case, most likely she'll say no use of contraceptive device. Okay, but you have to ask the gynae. Now coming to the sexual history, I'm going to be teaching you how to take the sexual history with my famous 311S technique. Okay, this is OG as well. You won't find this in any other academy because, honey, we need to keep it OG. Okay, there has to be something that's unique about me from Mr. Mo, Mr. Aldays, Mr. Nwanikas, right? So anyway, I heard something. Okay. 311S technique. So sexual history, don't ask bunch of questions. Have these questions in mind because otherwise there's so many sexual history questions that you get confused and you don't ask the priority questions and you focus on some lame question and then you're just screwed. Like you'll be like, are you using sex toys? Bro, what the heck? Like, why are you asking? Like, get it? So first question in sexual history should be, it shouldn't just be like, are you practicing? Okay, wait. What do you guys think? Should I ask this patient? Crap, I kind of gave it away. But are you going to ask this patient, are you practicing safe sex or not? Will you ask this question to the patient or not? Like the first question.
Yes. No, like no, not the first one. First, we need to tell the person, the patient that I'm going to ask you something intrusive. So if you're okay with it, should I
That's a
proceed?
very good point. Always signpost. Okay, I'm going to. Okay, so what was her name again? Alexa, I'm about to ask you series of questions, but this is completely standard protocol questioning. Okay, anytime you're uncomfortable, you can ask me to stop. This is very important in sexual history. Always start with signposting. Thank you, Seher. I'm going to add this point over here. So, next question. Are you practicing safe sex? Is that a good question? Who's going to tell me? Should I ask that?
You should specify if they're using condoms or not.
Okay, so first question. Are you using
No,
condoms?
are you sexually
First
active?
question should always be, are you sexually active or not?
Yeah.
Exactly. Aisha said it. So basically, honeys, you can't just randomly assume she's sexually active. That's the whole point. So be very careful with your words. You're not going to assume she's sexually active just because she has a discharge. Because what did I say? Candida and all can be caused without STIs. This is why such an important thing to do. Are you sexually active? First ask. Yes. Don't assume she has a husband. Don't assume she has a boyfriend. You have to ask. Could you specify the gender of your partner? Don't forget that. Okay. Now, 3S from the person. This is how you're going to go. 311S technique. 3 S's from the person. Are you sexually active? Yes or no? If she says yes, proceed. S. Do you have a stable partner? It doesn't matter if it's male or female. Do you have a stable partner? Why do we need to know about the stability? Because more chances of STI, the more unstable she is. Because 20 million people, more chances to be exposed to those, right? Do you have a stable partner? Yes or no? Up to her. Okay. Probably she'll say, in this case, she says yes. Okay. Okay. At this point, you can even ask the gender question if you'd like. But in this, there's no, okay, you don't need to. Don't worry. She most likely will say yes with my husband. She most likely will tell you. Okay. If she doesn't, could you specify the gender of your partner? Doctor, it's a male. Okay. All right. Could you tell me if you're practicing safe sex? So in UK, keep in mind, everyone knows what safe sex is. They are educated in their school about safe sex. They're educated everywhere about safe sex. Maybe not in our countries, so you don't need to mention condoms. Okay. Maybe in our countries, we need to say that word because we do have some uneducated population in our country. But in that country, everyone knows what safe sex and they should know what safe sex is. Okay. If she might say, what is safe sex? In that case, you can explain it to her. Okay. So are you practicing safe sex? She will say, yes. If her gender, if her she has a female partner, in that case you ask about sex toys. Okay, because sex toys are going to be the source of infection. Okay. However, in these cases, it'll be simple. It'll be a male. Okay. Are you sexually 3S from the person? Are you sexually active? Do you have a stable partner? And do you practice safe sex? Okay. Then 1 from the partner. Does your partner have similar symptoms? No, doctor. Okay, and one from both. Are you both screened for STI? Have you been screened for sexually transmitted infections before? So this is the sexual history questions made easy. So 311S technique. So 3 from person, 1 from partner, 1 from both. It's all S, begins with S. So who's going to tell me what are the sexual history questions with the 3-1 SL technique?
I will.
Well done, sir. Go. 3.
Okay. Okay. So first of all, we are going to signpost. Then we are going to ask three questions from the patient. That is she sexually active? Does she has a stable partner? And also, what is the gender of her partner? And if she is sexually active, then is she following the is she practice safe sex or not? And
Very
also
good.
about the sex toys. Then
If lesbian.
one if lesbian, and then one question from the partner and one from both. The partner question would be like the similar symptoms if he has, and
Yes.
from both would be like have you, what was it from both? I forgot that.
Who remembers it?
Have you both been screened
Screening
for
of
it?
both STI.
Brilliant, guys.
Oh
Brilliant,
yeah.
brilliant. Exactly. Okay, so don't forget this. There's significance, there's strategy behind the structures that I make for you guys. Sexually active stability, you all know why. Safe sex is a very, very important question. If they're not practicing safe sex, 2 things come into play: pregnancy and STIs. If they say no to safe sex, in your management, always include, I will have to screen you for STIs. Even if she has no symptoms, it's a random case, but she said no to safe sex, you have to screen her as a doctor, as a good doctor. Safe sex question says no, you are responsible to screen her, no matter what she says, okay? No matter what the case is, okay? Anyway, and partner, does the partner have symptoms? Very important question. What if the partner has symptoms, she's asymptomatic, who knows, okay? And both, have you both been screened? Yes, doctor, we both have been screened. Good. Once you've asked this, once you've done the gynecological history and you realize that she has a greenish discharge, which has no itching. And what else did she say? She's embarrassed about it. In her sexual history, she's sexually active with her husband and she hasn't had sex since the past month because she's embarrassed about the discharge. And her last menstrual period was about 2 weeks ago. This is how the case will present to you. Okay. Now you're confused. How do I diagnose like what do I do next? Like this can be so many things. This is so non-specific. Like it can be TV, it can be GV, it can be like what if it's gonorrhea or something. How do you figure that out? There's just one solution. Okay. So who's going to tell me how do I relieve that confusion? I'm so sorry, guys. I completely forgot. Don't forget to add history question asking about recent changes in soap. I mean, okay, I'm sorry, guys. Recent changes in soap, bubble baths, and tampons. Add on these questions. If you guys love me, don't forget the SBT sessions that happen from 3:30 p.m. to 5 p.m. SBT. Oh my God, that makes so much sense. How did my fog brain just make such a cool mnemonic? Okay, so don't forget the SBT session. Everyone needs to join the SBT session whenever someone comes with vaginal discharge. I'm sorry. Okay, SBT is always ask about, have you recently perhaps changed any kind of soap? Okay, do you use soap down there? Okay, and how about any baths? Do you take baths? Yes, doctor. Do you take bubble baths? Yes, doctor. Okay, and how about tampons? Are you using tampons? Yes, doctor. So, do you recall maybe perhaps leaving any tampon in there? No, doctor, no. Okay, so SBT sessions should happen whenever there's you're suspecting a lower vaginal infection. Okay, so she will say yes to soaps. She will say yes to bubble baths. She will always say no to tampons. Ready now? Now, the only way to determine what the hell this is, who's going to tell me? There's someone that has the answer. The only way to say for sure that this is a lower vaginal infection. How can you say it? No? Oh my
If she's
God. Aisha,
not sexually active,
yes, she's sexually active, but how to say for sure that this is a vaginal infection? Like, we're done with the history taking part. Now, how can we just say to her that it's a vaginal infection? There should be some way to like kind of confirm it.
Then we will go through the upper speculum examination.
Well
And
done. How can
mm,
how can you guys forget the examination part? Now you tell her, I would like to have a look at you. It will involve me doing your per vaginal and most importantly, a per speculum examination. So guys, add on per speculum in these cases. Where you did the UPTs, you did the, I don't know, BMIs, you did like the chest examinations. In cases of vaginal discharge, add on the per speculum examinations. Okay, in discharge cases. So what will you see? The per speculum, the moment you say, I would like to do a per speculum examination, the patient is going to hand over a clipboard to you. If you don't say the word per speculum examination, she will give you nothing. She'll just be sitting and looking at you and waiting for you to say something. And then you'll just wing it. You'll just say something like, this might be, and then you'll be like completely underconfident through the whole case. You'll be like, how am I confirming? Okay. So that missing link is the per speculum examination. Okay. The moment you say perspective, she's going to give you a clipboard and the clipboard will tell you your findings. The clipboard, you know what it'll say? The clipboard for Candida, we all know what's going to say. Usually, the most common case that comes even nowadays that even came on you didn't hear it from me. Yeah, my exam was composed of this entire scenario. Anyway, so in this case, what do you need to say? You need to say, so what am I forgot. In the per speculum, the findings will be written. And sometimes it won't be written. They'll just give you a picture of a weird thing. And you know what it's going to be? It's going to be a retained tampon and discharge all around it. So she basically, all you need to tell her that, honey, you've had a vaginal infection and it is because of the tampon inside. This is the most common case coming from the lower vaginal infections. Okay. So you're going to tell her, how do you deal with a case like that? Nothing. It's very easy, very conservative treatment. Okay. So green, no itch, tampon, it's most likely vaginosis. All right. So you have an infection. So thank you so much for talking to me, Marissa or Alex. Alex, thank you so much for talking to me. So it seems like having a look at you and after talking to you, I gather that this seems like a case of a vaginal infection. And it's most likely because there's a retained tampon in there. And guess what she'll say? Oh my God, I don't even remember when I kept it in there. That's why she'll always say no to tampon. Okay, so but you have to ask the tampon question. Okay, it's the golden question. You have to ask about tampon because later you were right, but it was her that couldn't recall. Oh shoot, I must have kept in there, but I completely forgot. And then she's gonna feel super bad. She'll be like, I completely forgot. I'm like, it's okay, it's okay. She's like, what's gonna happen now? I feel so bad. What's gonna happen? And all you have to tell her is that you have to console her. You have to reassure her that, Alex, so basically, there's nothing to worry about. Right now, we are going to perform tiny procedure and we're going to remove the tampon, okay? And then we're going to wash the area a little bit up. Will that be okay with you? Okay. And once we're done with that, so basically you have to remove the tampon with the forceps and then do some irrigation. So you have to say it in simple words. And once that's done, I'm going to give you some antibiotic to treat the infection that the retained tampon has caused. Are you following me? Yes, doctor. Okay. You, even if you don't say the name of the antibiotic, it's okay. That's how PLAP 2 is, guys. Just say, I will also give you a medication called metronidazole. This is a type of antibiotic. You're going to take it on a daily basis. Okay. And I advise until you're better, you can. She might ask it, can I like have sex during the treatment? Most likely she won't want to have sex until her discharge has cleaned off. Okay. So this is the whole situation. So the very easy cases, if it's Candida, most likely she'll have itching, she'll have some diabetes or some steroid going on, and she'll have a white curdy discharge. And she'll be embarrassed about it. So in that case, you'll just say, it's nothing. It's a limiting infection, self-limiting infection. It's Candida. It's a fungus. You explain it to her. You tell her the treatment. I will give you clotrimazole. Doctor, I don't want to eat any medicine. Okay, I will give you topical, as Aisha told us, was I will give you cream form, intravaginal form, you can apply it. Even metro, by the way, oh, sorry. In the case of vaginosis, the patient usually has a concern. Doctor, I don't want to eat a medicine. Actually, I don't like taking pills. Okay, then that's totally fine. I'll give you a vaginal metronidazole. You can apply that daily basis for 7 days. Okay, you can make up a 7 days, whatever you want, doesn't matter. You don't need to know the durations in PLAB 2. Why don't you know the durations? The biggest proof, I'm going to give you like a good explanation for that. Every NHS hospital has a different protocol for antibiotics. Some say give, for instance, the hospital of like London College of Hospital, whatever, will say the guideline is give metronidazole for 3 days. Some other random hospital like Manchester Oldham Hospital will say give her metronidazole for 7 days. So that's why you don't need to know the duration. They don't expect that from you. They expect that when she goes to the NHS, she'll know. But all we need to see, does she know antibiotics should be given or not? That's how simple this exam is. Okay, and then just safety net at any time you have tummy pain, fever, come to the hospital immediately. So these are the lower vaginal infections. Now let's ascend our life. Okay, let's go up and beyond. Now let's talk about the STIs. Okay, I want to tell you a very interesting fact. The STI, sexually transmitted infections, who's going to tell me what is the difference between, like, what are the sexually transmitted infections? Give me the names.
HIV, syphilis.
Chlamydia, gonorrhea.
Very good. Okay, we're going to touch chlamydia, gonorrhea, because that's the case that comes in PLAB 2. Okay, who's going to tell me where the STI, chlamydia, gonorrhea are going to attack? You have the whole uterus in front of you. You have the vagina, you have the cervix, you have the uterus, you have everything. Where, and you even have the blood. Where do you want to attack with the chlamydia and gonorrhea? Let's shoot. Where do you want to attack? Who knows?
Cervix.
Cervix.
Well done. Yes, brilliant. So cervicitis is caused by STIs. So vaginitis, most likely it's bubble baths and stuff. But STI targets the cervix. This is very important. And this is something not everyone knows. Maybe upper vagina area or the cervix. So cervicitis is mostly caused by the chlamydia and gonorrhea are the two main bugs or culprits. Chlamydia and gonorrhea, two main culprits targeting the, what do you call it, cervix. Okay, and the most important thing about chlamydia and gonorrhea are, let me tell you. Okay, they both target the cervix. So the main symptoms of chlamydia and gonorrhea are, who's going to tell me? Who's going to tell me? Since it's cervicitis, it's inside, maximum.
Pain during sexual intercourse.
Okay, that's like, one of the rare symptoms. One main symptom is that, listen to me, chlamydia and gonorrhea, since it's cervix, since it's just cervix, right? The maximum thing that'll happen is a discharge. Okay, maximum discharge, and sometimes asymptomatic. You get what I'm saying? So discharge, maximum you'll have discharge, because obviously it can cause an itch. It can cause reddening of the vagina. So what will the patient present with? I'm not saying what will you see on the speculum. Are you seeing cervix or no? Patient, what will he see? He will, maximum he'll see discharge. Time, yeah, doctor, I have discharge. Okay. So let me tell you one thing. There is no way that you can diagnose chlamydia or gonorrhea in the GP with clinical side alone, with clinical history taking and examination. You cannot diagnose them. Okay, you cannot diagnose, is it chlamydia or is it gonorrhea? You can never diagnose that. The only thing you can do is maximum from his history, get the blood tests done, the blood culture done, the swab done. Only then you can know for sure whether it's chlamydia or gonorrhea. Okay, got it, guys? So what I'm trying to say over here is that the vaginal discharge, the lower vaginal infections, they can easily be diagnosed clinically. Okay, clinically means Just by talking to him and by history and examination, you can diagnose in the clinic. Okay. But for these infections, you have to refer to something in the NHS called
Genitourinary medicine
very
clinic.
good, Aisha. Gum clinic. In NHS, just remember one thing. Gum clinic is a very important term I want you to keep with yourself. In the NHS, there's a whole clinic dedicated for people with STIs. So this time you don't refer to the gynecologist. You refer to the gum clinic. Keep that in mind. Okay. So anyway, I will refer you to the gum clinic who will do your tests to screen you by taking your swab and your blood culture to screen you for STIs. That's the only. So, honey, always remember there is no way to know by his symptoms only. You don't even need to do per speculum in these cases. But even if you do per speculum, there is no way to know whether it's chlamydia, whether it's gonorrhea, whether it's even a STI. Okay. The only way you can know, I need tests. I need tests. You cannot know. So, therefore, in PLAB 2, chlamydia and gonorrhea will never present in the form of diagnosed chlamydia, never. You will never have to diagnose. You know how it will come? In PLAB 2, it always comes in the form of tests. Mary Jones has presented to you. Last week, she came to get her screening done in the gum clinic. You are in FY2 in the gum clinic. So some Mary Jones came to you. She got her test, and then her tests show gonorrhea positive or whatever positive. Okay. Rest HIV negative. Okay. So now go and talk to her. This is how your cervicitis infections will come to you in PLAB 2 exam. Okay, all you have to do is have a talk with her. Just talk to her about, what will you talk to her about? Number one, what are you going to talk to her about? Sexual history, very important. Complaint inquiry, first you'll talk about, okay, is there any particular reason why you got the test done? Who remembers the rapport building part of a test case? If there's tests, how do you change your rapport? Well done, Asma is actually participating in the chat. So in your rapport, all you have to do, hello, I'm Dr. So-and-so, one of the GPs in the, one of the FY2s in the gum clinic. Are you Mary Jones? What's your age? All right. I have your test results here today. Okay, tell her the purpose. I have your test results with me today. However, before I can reveal them to you, can we have a chat? So whenever there's a test report case, the only change you'll make is tell her the purpose. Yes, I'll reveal to you your test, but first we need to have a chat. Will that be okay? Yes, doctor. Asma is multitasking. Well done, Asma. Keep going. Okay, I hope this also helps you a lot because, you're actually listening. Well done, Asma, for multitasking. Okay, and still responding in group. Proud of you. Anyway, FY2 in the gum, and you'll actually enjoy in the academy even more than this because yeah. Moving on, FY2, yeah. So you're going to tell her, I have your results with me, but before that, I need to talk to you. Could you tell me why you got always first question, why did you get the results in the first place? No need to even ask, are you having any kind of symptoms? No need to go through that awkwardness. Just say, why did you get the test in the first? Actually, doctor, nothing. I just felt like there's something going on. Like, I had a discharge. Or most likely she'll say, just generally, doctor, I decided to get a health checkup. So this is why I'm saying these infections come asymptomatic. So don't worry if it's asymptomatic, doesn't mean she's not infected with it. Okay. Now, what you'll do for her is that, honey, okay, now you're just gonna ask her, okay, how's your overall health like? Okay, could you tell me if you have, try to keep your history specific to the tests. So you're gonna ask her, have you noticed any kind of discharge lately from your front passage? Don't just say discharge lately. From where? Eyes discharge, nose discharge, what discharge? Okay, so front passage. Keep that word in mind, okay? Have you noticed any discharge from your front passage lately? No, doctor. Okay. What will you ask? Red flag questions for PID. Have you noticed any fever? No. Have you noticed any tummy pain? No, doctor. Okay. Any lumps and bumps on the body? Guys, there is one more red flag I want you to add in this case. Who's going to tell me what that? It's actually very bad.
Lymphadenopathy.
Very good. Zara remembers I think I taught this I don't know, last week or something. Zara, why are you asking about lymphadenopathy?
Because of HIV. HIV.
Very good, guys. Even if it's HIV is negative, you still have to show to the examiner. I'm not stupid. I know that STIs include HIV as well. Okay, that's why you're gonna do the PID. 100% you're gonna do PID. You know, if gonorrhea is in, PID is a possibility. Wait, what? Didn't Dr. Hasna just say it is a cervicitis? Doesn't gonorrhea and chlamydia cause just cervicitis? If you are not treating Mr. Chlamydia and gonorrhea, what happens? These become ascending infections. And that's how we go to yesterday's episode. That's how we reach the pelvis. That's how they cause PID. So PID is basically caused by these STIs. If the person remains asymptomatic and doesn't get tested and gonorrhea are just like living in the body and they're like, bro, you know what? I think it's time to buy a house. Let's do the next step of our relationship. Chlamydia and gonorrhea, like, yes, let's do it. Let's go. And then they ascend, they build, and then they have this house. Now the uterus, ovary is all of their own territory. So that's how it works. So this is how PID happens. So that's why STIs like chlamydia and gonorrhea are very dangerous because they can lead to PID. So PID causative organisms are also Mr. Chlamydia and gonorrhea. These two are husband wives that are looking to invade this uterus. They're just waiting. Okay, but initially they only get like a tiny townhouse and it's bad. It's like a cervix only. That's all they get. If we are able to destroy them, we will never go to PID. You get what I'm saying? Now, these are basic concepts, guys. Okay. So now what are we saying? Yeah. So you're going to do the PID red flag and then you're going to do the HIV red flag. Done. Okay. And now you move to, do I need to do family history, honey? No. Do I need to do long term? Okay, tell me, do you have any long term medical conditions? Because once again, diabetics are more prone to getting infections. So, no, doctor, I don't. Any medications you're on? No, doctor. All right. Any allergies you have? The reason I'm asking, who knows why I'm asking about allergies? Who's going to tell me? I'm asking allergies. How's that relevant?
In case
Because we have to treat
Can
her with
giving
the antibiotics.
biologic too.
Wait. Zara opened her mic first. Zara, go ahead.
Because we have to treat her with the antibiotics.
Oh, very good. Arshi and Asma, did you say the same thing?
Yep.
Yes.
Well done, guys. Geniuses. Brilliant. So, guys, listen to me. Whenever you know that in the management, I'm about to give her some antibiotics, some intensive treatment, always allergies is a very relevant question to ask. Okay. But don't ask allergies in like anorexia. Like I've seen people they ask and like allergies. Like, why are you asking allergies? Okay, anyway, it doesn't matter. Okay, there's a tiny point. I just want to make you guys perfect for some reason. Thing is, if you can't be perfect, that's also fine. Just pass the exam. Okay. Now, where were we? Basically, allergies. No, doctor, I don't have any allergies. Okay, now that's about it. Now I'm going to start my most important questions, sexual history questions. All right, so I'm going to ask you some signposting. Okay, signposting done. Ask her all the 311S technique. Who would like to go through the 311S technique?
I can do.
Go ahead, Aisha.
I'm so sorry to ask you some series of questions related to your sexual health. Is that okay with you?
Yes.
Okay. Are you sexually active?
I am. Yes.
All right. And do you have a stable partner?
Yes, doctor. My husband.
Okay. And do you practice safe sex?
Sometimes we kind of forget to do that.
Okay, all right. And like, is your partner is having the same symptoms as you are having?
For instance, she does not have any symptoms. What will you ask then?
Okay. Is your partner is having any symptoms?
Like what, doctor?
Like any discharge from or burning or painful urination?
No, doctor.
Okay. And is your partner and you are screened for sexually transmitted infections?
So in this case, she has been screened in the prompt. So you just ask, has your partner been screened for STI? Okay.
Okay.
So she might actually, because always be very careful in PLAB 2, they actually say it to you. On purpose, they do it. They'll be like, doctor, I just got screened. Why are you asking me that question? You get what I'm saying? So be very careful. This is
Okay.
why the examiner crosses you in active listening. This is very normal because you actually, these are tiny mistakes, but like They're completely preventable if you practice, but very good. These are the questions. Well done, Aisha. Now, now someone else open their mic.
I've already done it, so that is why I'm
You've
not
done it. Yeah.
opening
No,
them.
no, no. We need a new person. Open your mic. I'm giving a tricky situation now. The moment they hear tricky, they're like, I don't want to open my mic. I'm scared. It's not that tricky.
I'll do it.
Okay. So once again, ask me the sexual history questions. You've done the signposting. Just start the sexual history.
Okay. Could you tell me if you're sexually active?
Yes,
Okay. And are you in a stable sexual relationship?
I am.
Okay. And would you say you and your partner practice safe sex?
What do you mean by safe sex?
Okay, by safe sex, I mean when you all engage in sexual intercourse, do you all use condoms?
Yeah, no, we don't.
Okay. All right. Is she having any symptoms?
Who's she?
No, no, I'm asking you, Dr. Hasna, is
Okay.
having any symptoms or
Sorry.
not?
It doesn't matter what she's having. I'm just trying to like, can you ask the gender of her partner?
Okay, yeah. Okay, could you tell me if your partner is male or female?
Oh, it's female.
Okay. And could you tell me if you all also use sex toys during
Yes. Okay, so guys, if she's not saying the word husband, she's not saying the word boyfriend, normally they say it. If they don't say it, always make sure you know the gender of the partner so that you can ask the sex toy question, okay? Because then you have to, in the management part, educate them about the sex toys use, okay? Because sex toys can cause the STI exactly the way heterosexual intercourse can cause STI, same way sexual toys can cause. Otherwise, lesbians, there's no other way, okay? So this yeah, what was the point? Yeah, we're back to that case. Okay, done. We're done with the sexual history questions. Now, coming to the management. Okay, thank you so much for talking to me. You do not need to do examination or bedside test in this case. Why? Because tests have been performed. You have the diagnosis. You don't need to get to a diagnosis. If you want to get to a diagnosis, that's when you do the examinations and the bedsides, right? So you have the diagnosis. All right. Thank you so much for talking to me, Alex. So I have your results here with me. And unfortunately, Alex, you have tested positive for gonorrhea. Do you know what that is? No, doctor, what is that? It is a type of sexually transmitted infection. Okay. And it's something that, and she most likely at this point, she will ask you, how's that possible, doctor? I don't have any symptoms. This is going to be her first question. How's that possible, doctor? I don't have any symptoms. Nothing's going on with me. So that's when you have to tell them that sometimes these infections can be asymptomatic. You don't necessarily have to have symptoms. Are you following me? Yes, doctor. So what is the treatment? How do you go about the management for STIs? I have just one general management for all STIs. Just follow this. Whether it's chlamydia positive, whether it's gonorrhea positive, whether it's an STI positive, there is just one treatment. If in the GP, if you are not in the gum clinic, refer to the gum clinic. If in the gum clinic, then forget this step and just do the next part. Test screening is already done. Nothing. Next part. This part, I will put you on antibiotics. No need to know which antibiotics. Otherwise, we all know for gonorrhea, we have injection ceftriaxone in stat. You give it first injection and then you give the next injection in a week. So I will give you an antibiotic via your vein. So if it's gonorrhea, you go for antibiotic via your vein. Whereas if it's chlamydia, you just say, I'll give you a course of antibiotics. Are you following me? Yes, doctor. Okay. But there are some important, if you want to pass a case of STI and be safe, doctor, if you don't do these three things, that's when you fail the exam. Not the exam, but the station. Okay. Failing exam is such a big thing to say. It's so rude of me. No. You fail the station. If these three things are not said, whenever there's anything related to STI, not practicing safe sex, sex issues, sexual screening, These three advices, if not said, even one is missed, not okay, not okay, not okay. Okay, you have to advise her. I advise, until the treatment goes on, kindly do not practice sex. Okay, do not have sex while you're on the treatment. Are you following me? Who's going to tell me why can't you have sex while on treatment? Doesn't make sense. That's actually a very interesting concept question. Go, Aisha.
Like if the other person has symptoms, or like it will not, you will again you will have the same problem then. And if his partner has not the symptoms, then he will get it, or something like that.
Aisha, could you repeat that? I'm very sorry. I was reading a message from one of the mentors. I'm very sorry. Could you repeat that?
Okay. So like if his partner has not have a symptom, and she has a symptom, then she can transfer to the partner as well. And secondly,
Very
if
good. Very good.
secondly, it can be like, if they are not treated, then before that they have like this problem will not be solved. They have again these kind of infections.
So well done, Aisha. Very good point. The reason we need to tell her to no, please do not practice sex is because she can give the infection to the partner. What is the second most important reason? The partner might have it and give it to her again. It goes both ways. What if the partner was the reason she got it in the first place, and she's on treatment, and then she's still getting gonorrhea, like you know what I'm saying? So always ask her to, please, my love, do not have sexual intercourse while you're on treatment. Now coming to the most red color point. If you don't say this, you have failed in the management. You are not a safe doctor. You have to tell her, and Marissa, I have to talk to you about something important. Yes, doctor, please. I advise that you have your partner come checked and screened and treated if he has the infection as well. Are you following me? No, okay. She'll say yes. Okay, most likely, yes. You won't need to go to this part, PNP part. Okay. However, now I'm going to tell you a variant. Listen very carefully. Anytime you guys get confused, you always tell me to stop and go slow. Okay. Sometimes this case presents in the form of not having a stable partner. She does not have a stable partner. She went to Thailand. She cheated on that damn guy. I'm so sorry. And she reveals it a little later. Doctor, actually, I cheated on him. And since then, she got the infection. So you're going to tell her, I advise that you get your partner checked. She'll be like, doctor, no, if I tell my partner, then he will know. He will know that I was with someone else. Most likely there's going to be a male. Okay, because men cheat. I'm just kidding. So he's gonna be like, doctor, she'll find out. Doctor, no, I can't tell her, sorry. In that case, you will activate. Okay, how about Max? How about this? PNP. How about we inform your partner through the partner notification program? In that, we will invite her. We will invite her to get checked, and you will remain anonymous. Yes, doctor. Still, he will resist you. He'll say, doctor, but she'll know. Even if I'm anonymous, the only person she's been with is me. You get what I'm saying, doctor? So you'll tell him that I understand where you're coming from, Max. I know that this is definitely hard for you, but I want you to know that if she doesn't get treated, then it can result in her getting the complications of this disease, which is in like if she's not treated early, it might even progress to infertility. Why? Who's going to tell me why is this leading to it? How does gonorrhea lead to infertility? That makes no sense, doctor. Who's going to give me a good explanation? Geniuses?
PID.
Yeah.
Pelvic inflammatory disease if the infection ascends.
Well done. If gonorrhea not treated, it's ascends. It's like, bro, let's make a mansion because, now we're like inhabitants of the cervix. I think we're done. Okay. The population is enough over here. Let's expand our city and go to the city. So exactly. So you have to tell him that if she doesn't get checked, then she might develop complications, which is unfair to her. You know, it can even lead to infertility. So that's why she should get treated as soon as possible. And then when he hears this, when he hears the word infertility, most likely he'll say, okay, doctor. And even if he doesn't agree, write it down in your notes right now. Important things I'm telling you. Golden hacks. Even if he does not agree, I'm sorry, you will inform him. Like you can't, it's just like a DVLA situation. No, honey, I get you, but we will have to inform the DVLA. We will have to involve your partner. There's no such thing as, okay, whatever you say, sir, okay, sorry. No, that's not how nice you need to be in NHS. Yes, you can be nice, but there are some rules you need to abide by, okay? Next is, and also, John, before you go, I advise that for the future, once you and your wife are treated, I advise you guys to practice safe sex to prevent any complications and any STI developing. Are you following me? Yes, doctor. So whenever it is an STI scenario, chlamydia positive, gonorrhea positive, um, HIV positive even, always do these three things. Partner notification program if he resists to involve his partner himself. So this is the major doubt of students, is that do we inform, what if he says yes to for us to inform the partner? Do we need to do the PNP? We don't need to do the PNP. PNP is when, if he says, doctor, no, please, I don't want to inform the partner myself. It's just like a DVLA situation. Like you need to inform the DVLA. Okay, I'll inform the DVLA. We don't need to do anything, but we need to say, like he has to. Basically, PNP is all about, okay. However, who will tell me what is the other word that comes if the person is not married, not a stable person, not cheating? He just like goes about and he's like, I don't have a stable partner. I sleep with like maybe like 7 people in the past 3 months. In those cases, you say the word contact tracing. Okay, we will have to do some contact tracing and trace your partners and have them invited to get tested. In that, you don't need to do the PNP. PNP is for the partner. When you have a partner, he does not have a partner. Got it? Hope that makes sense. So that was all about STI, not exactly all. Now we've entered the danger territory. We've caused PID. Who's going to tell me the treatment of PID if you were attending yesterday's lecture? Who's going to tell me what to do? Patient has presented lower abdominal pain, discharge, fever, chills, feeling low, looking non-alert, looking drowsy.
IV antibiotics. We are
Admit.
going to call the gynae to review as well. And then the PNP.
Brilliant, Seher, brilliant. PNP. She remembered. So first things first, before you, so Asma, this is what I want to teach you. The first thing that should click into your mind shouldn't be ceftriaxone. That's more knowledge-based exam. What's PLAB 2? PLAB 2 is admit and inject him. That's it. That's PLAB 2. What's PLAB 1? Ceftriaxone is PLAB 1. Ceftriaxone is MRCP, MRCS, ABCD. Okay. But PLAB 2 is all about admit injection. That's the difference between other exams and PLAB 2. And Seher, well done. PNP. Don't forget to involve the PNP in pelvic inflammatory disease. Okay. Now let's talk about, why did I draw the blood? What are we doing next? We are going to attack the blood now. Who's going to attack the blood? Yes, gonorrhea and stuff, they also attack the blood. Yes, when PID is basically, PID can lead to sepsis. The reason we're so worried when the patient comes with PID, the reason we admit him, because there are chances, if he's feeling fever and down, there are chances he is going into sepsis, because obviously if something has entered your pelvis, they can enter into the blood, and once something is in your blood, it is known as sepsis. Okay, when bacteria is, that's why usually the reason why we admit people with PID, because that sepsis could happen. That's why we have to prevent that and we have to save them. Anyway, next is another disease, that is STI. Very important, guys. Luckily today I'm so excited, we're going to end early today. Okay. We're going to be done early today. I'm so happy about that. Why am I so excited about that? Anyway, that's so rude of me. I'm excited for you guys, okay? So anyway, now let's talk about the elephant in the room that we haven't been talking about for a really long time. Who is the elephant in the room? We all know. HIV, okay? We haven't really learned much about HIV in the PLAB 1. So HIV, okay? HIV, for sometimes the patient will present to you, she came for a random testing and she has come out to be gonorrhea and everything is negative, but HIV positive. This is how the case will present to you. So you don't worry, you will never have to diagnose HIV, but even if you have to diagnose, it's most likely going to be like, he will have lymphadenopathy and a sexually active history. That's when you'll be like, I will refer you because it seems like it could be HIV. Okay. Or sometimes they'll just present with HIV positive. So what you're going to do is you're going to ask her the history. And what is the history you're going to ask from her? It's most likely going to be, have you noticed any lumps and bumps? Yes, I have noticed a lumps and a bumps. How about any weight loss? Not much. Have you experienced any flu-like illness? Flu-like illness could be because, you know, immunity goes low in HIV. So have you noticed any flu-like illness? No, doctor, just some lumps and bumps around my body. Okay. How do you treat HIV? If you are in the GP, refer to gum clinic, nothing else. You don't deal as a GP with HIV. You throw him to the gum clinic. Okay. And once again, what do they do in the gum clinic? They'll screen you. They'll put you on antiviral. That's all. In PLAB 2, all you need to know is that they'll treat you with antivirals. They will keep monitoring you, but you don't need to know much about it. What's going to happen in the HIV case more is basically one thing will be that he will have many, many concerns. And you need to know how to address HIV concerns. And number 2 will be the legality issue. I'll tell you what it is. In this case, legality, whatever you call it, okay? I'll tell you how. So HIV has come to you. Now you'll say, thank you so much for talking to me. So Max, from what you're telling me, basically your results have come in. You have tested negative for the gonorrhea. You have to make sure in the results, you have to mention what he's negative for as well, okay? Don't hide that from him. Don't just be like, you are HIV positive, my love, okay? So be like, you've come back negative for gonorrhea and all. However, Max, we are concerned because, and I'm sorry to tell you, make it a little bit like a BBN, okay? A little bit like BBN. Like, Max, I'm sorry to tell you, and sometimes this is a sole BBN case. Break the news to him. Whatever it is, always, whenever you have to break it down, when it's a suspicion of HIV, where you don't have the test in front of you, you don't have test results saying HIV positive, it's a suspicion, you don't need to do BBN. You do need to do BBN when it's HIV positive in the result. Okay? So you'll say, all right, John, I need to tell you something. Would you like someone to be here with you? No, doctor. Tell me, okay, as you told me that you got tested, just small narration, you got tested for HIV and we did the test results have returned. You have tested negative for gonorrhea, chlamydia and all. However, John, I'm sorry to tell you, but you have tested positive for HIV. Stop, let him digest the news. So just like a BBN, you have to do a little BBN. When do you do a BBN? Only if result says, if result positive. Not if it's a suspicion. In a suspicion, you don't do BBN. Even if it's a cancer suspicion, you don't do BBN, my love. Don't make that mistake. So it's in a suspicions you never do, because obviously it's not a bad news yet because it's not diagnosed. Anyway, so you have HIV. Now let's see how he responds. Most likely he'll have 10, 20 concerns. And that's all. In HIV, mostly you will only be addressing those concerns. So first things first, if you are already in the gum clinic, we need to get you started on like the treatment ASAP. We will give you some antivirals and check your viral load. Okay? Are you following me? Okay, doctor. Doctor, the next question, the next concerns, basically you'll only be dealing with his concerns. What are the concerns he'll come to you with? He'll say, number 1, first concern will be, doctor, so I have AIDS. Who's going to tell me, does a person with HIV have AIDS? What is AIDS? Let's see who knows. Very tricky question.
AIDS is a
No, it's
complication
not.
of HIV.
It's,
So it's
yeah,
not
Very.
late.
yeah.
So could you explain the concept behind it?
AIDS is basically the final stage of HIV when the CD4
Brilliant.
count falls below a certain limit. So if
Very
they've
good.
diagnosed it in the initial stages, if he receives the correct treatment now, it won't progress to AIDS.
Brilliant. So make sure you calm him down. So, doctor, I have AIDS. No. Max, I'm very sorry if that's the impression I gave you. I want you to know that it's not AIDS. Let me explain to you. There is a difference between HIV. You have to literally explain this to him with baby words, like easy words. HIV is a type of virus that destroys your immunity. Are you following me up to now? So, God, what did I teach you guys? The one line method. One line method, give him food. That's it. Is it tasty enough? One line food, is it tasty enough? So, whenever you're explaining, do that. First, tell him what is HIV. HIV is a virus that destroys immunity. Are you following me till now? Yes, doctor. Okay. So right now you are positive for HIV. You have the virus that can destroy your immune cells. AIDS is when HIV has completely destroyed your immune cells. When it has been successful, that's when you go to a state where you're very prone to all infections because you have no immunity. At the moment, we need to test you to see how much is your viral load, test your immune cells to know which stage you're at. And if we treat you early, this might not even develop into AIDS. So always reassure your patient. Okay, are you following me, John? Yes, doctor. Okay, he'll feel a lot better with that. So HIV is just virus. So what did I tell you guys? This is what I'm teaching you guys, is that please learn on how to make big explanations into bullet points. It will always work for you. This is my biggest hack. Just kidding. This is not my biggest hack. This is one of my biggest hack. You guys are probably everything is your biggest hack. HIV virus is a virus that destroys immune cells. Keep simple definitions in mind. Are you following me? After every bullet point, are you following me? Okay. Yes, doctor, I'm following you. AIDS is when all immunity gone, destroyed successfully by AIDS. Sorry, HIV. So at the moment you haven't developed AIDS yet because see you told me you're not feeling sick. You are most likely at a very early stage, but we will check your viral load. We'll check your we'll do some tests to know for sure, and then to prevent it we will treat you with antivirals, and we hopefully you're going to be fine. The most important part of AIDS is, my love, listen to me, legality issue. You, in this case, see over there you had to tell him please inform your partner. If he says no, I don't want to inform my partner, it's a legal issue. It's a crime if an HIV person does not inform his partner. It's a crime. He can go to court, he can be in jail if he doesn't tell his partner that he has HIV. This is the only, and if it was gonorrhea and chlamydia and he's not informing, we can't send him to jail, but we have to be like, honey, we have to tell your wife, I'm sorry. But this HIV is a legal issue, legal issue. So that's how you're going to scare him. So you're going to say, and I do advise that you inform your partner as well. No, doctor, I don't want to inform. Oh, Max, I understand that this is a difficult thing to inform about, but I want you to know that if you don't inform your partner, it can become a legal issue. You are legally bound to inform her. So this is something you should use in a case of only AIDS. Please don't say this in chlamydia, gonorrhea, okay? Now, let me just share my screen with you and teach you how to read from now. Let me show you the notes of HIV. Now that you've studied with me, let me show you how notes become easy. And I'll also tell you how to actually study notes. This is your case, FY2 in Gum Clinic. Now you all know what is Gum Clinic. You all know what, let's do what other academies do. Read the notes. Just kidding. Elliot White, since I've taught you, now I'm going to show you why after my lectures, notes are easier to read. Elliot White, 30-year-old, referred to the gum by the GP. Okay, that part is done. I'm the gum clinic guy. I have to do the gum clinic stuff. So it's very important to know what your role is. I hope if anyone cannot see my screen, always please message me. He had presented to the GP with lymphadenopathy. He had some investigations done. You can see his investigations, HIV positive. So what did I tell you? The results case. Talk to him, discuss result. Okay. Now this is what you have outside the cubicle. 1 minute to read this. The patient has, the simulator has read this. Okay. This is what the simulator has read. You traveled to Thailand 1 month ago with your friends, you noticed swelling in the eye and then armpit, then you flu-like illness, not on regular medication, no drugs. So drug history is important in HIV, guys. Keep that in mind. Okay, write it down in your notes. The drug history, recreational drug, because IV abuse can also call HIV. You had an affair with a prostitute, you are married for 3 years. So in this case, we all know the wife needs to be involved. The wife needs to be involved. You've had sexual intercourse with your wife several times since you came back from the island. Shoot. Okay. You work as IT, you do not smoke. Now just look at the case. Just I want to show you guys that notes are misleading. Notes will make you think. Just look at this, guys. What did I teach you guys? Probably I taught you 10 minutes. Look at the notes. This is HIV case. This is the notes. All of this, then all of this, then all of this, This 20 pages notes. Today I'm going to tell you that in PLAB 2, yes, there are 20 pages notes. Yes, it looks like an 1,800 pages book. But the good news is that from this entire 3-4 pages, half the things you have to skip. Okay. Now, if you try to read this, you're going to quickly go through. These are the most important questions you guys need to ask. But make sure you ask in my structure. While you're doing my structure, you're most likely going to address all of this. So these are the questions that the patient is going to ask you. Let's discuss the concerns. These are all the concerns he'll have. That's why I'm saying he'll have a lot of concerns. So grips, why did you come 2 weeks ago? Why did you have your test results done in the first place? What have you been told? Any worries about the test? Sexual history, as I told you guys, MAFTOSA and ICE. Basic things that we all learned, right? And then examinations, observation, lymph node examination, respiratory examination because he complained about a flu-like illness, okay? Now you go for BBN. Unfortunately, I'm sorry to tell you that you have come back positive for HIV. Pause because BBN, okay? HIV stands for immunity that damages and weakens your antiviral and it is transmitted. All of this in what 2 points of my bullet points, if you remember, that's how you're going to say this. There's too much crap, okay? No offense to them. It's most likely due to having unprotected sex in Thailand. When you'll ask him about the sexual history, are you sexually stable partner? He might confess, doctor, I do have a stable partner, but, or he might be uncomfortable. Like, is there something that you need to say? Because you seem a bit uncomfortable, John. Doctor, actually, I cheated on her. Okay. So, oh, okay. Could you tell me when was that? Doctor, just a month ago. I went to Thailand and I was with a prostitute. He might say it. Okay. And once again, it's your legal obligation to inform partner. So basically, the notes are very disorganized, if you notice. This is the problem with PLAB 2. This is why you get overwhelmed with this exam, because the notes are super like bunch of things together. Bro, you just broke the bad news. Now you're telling me to break the news in layer. What? So that's why I say I basically organize you and then you read the notes. The organization part is done. Now these notes are going to be piece of cake. They're not going to overwhelm you anymore because you know exactly what to say. You're just seeking some things from the notes, seeking some information like, okay, and AIDS stands for acquired immunodeficiency, state of very low and the body becomes susceptible. You don't have to memorize this. Don't memorize scripts. Make your own definition for AIDS. This state developed after HIV destroyed the immune cells. However, treatment people with liver, you don't have to say every single thing. Okay, because you have only 4 minutes. Now let's talk about his concern. Doctor, how did I get HIV? It's a sexually transmitted infection. It could be transmitted through penetrative sex, okay, or basically sex. Are you following me? Yes, doctor, that makes sense. Again, history, I don't know why, like what's this crap? Should my wife be tested? Or he won't even ask, you'll have to tell. In the future, you will need to inform your partner. So basically in the notes, you notice, guys, I'm only focusing on what's important. Like in the future, you will need to inform you. Like I know this thing. It's not necessary that I tell him all the points, but I should at least know that, okay, he's supposed to inform his partners in the future. If I get time, I'll also add this on. And if you don't, it's okay. Even if you don't say this, you won't fail. But the things that I told you in my board, if you don't say those things, you can definitely fail the management part. Okay, now these are his concerns. Should I inform my employer? This is the only thing you need to get from the notes. What's the answer to this? You do not have to inform the employers, okay? Unless you have an inquiry, depending whether this is too much, just say, no, you do not need to inform your employers, okay? And what do you do for a living? Doctor, nothing, I'm an accountant. If he says that if you seem like, what if he's like a prostitute? So if there is a risk of transmitted infection, only then you need to inform. Basically, that's the concept. But don't go that deep. This is too much. Just ask, doctor, should I inform my employers? Could you tell me what you do for a living? I'm an accountant. All right, you don't need to inform your employers. That's it. This entire crappy paragraph in one line. Keep it simple. Keep it simple. This is what I'm trying to teach you. Are you sure I have HIV? Can you repeat the test? Unfortunately, we have double checked the result. It has confirmed your diagnosis. Doctor, how is it going to affect my life? Need to inform medical insurance company. You don't need to say this. Even if you don't see this, you can't fail the exam. That's what I'm trying to say. Only keep important things. This is the problem with majority, because the notes are so misleading. They're so like saturated, so much information. People focus on giving all. Okay, so firstly, you need to like if you have a nature of a job where it involves the risk of spreading, bro, I'm an accountant. Is there a relevance of you saying this crap? No need. Okay. And then I wanted to tell you that I get a medical insurance. Bro, don't bring up new things. Just keep it simple. If he asks, doctor, will I get a medical insurance? Then you answer. You know what I'm saying? Do you have a medical personal insurance? It's important to tell them that you are HIV positive. Otherwise, your insurance may be void. The lame crap. Okay. So perception, paraphrase, okay, again, they've started the history taking. Something's wrong with these people. So his next question is going to be, can I have children? Of course, John, you can have children, okay? However, I do want you to first inform your wife, get her checked and treated. Are you following me? It's not a thing we routinely do. If the patient insists you help them, I need to take a second opinion from you. Put you anytime. Basically, don't worry about why is there a senior involved. Just say anytime he says something, he's convincing you, and you don't know what to do about it. Just inform your senior. It's just like a safety net. You just fall back to your senior. If something's getting very confusing and like odd, like he's like, doctor, please, like it's not a thing. I don't want to tell my wife, doctor, please, blah, blah, blah. Okay. If he asks about what HIV is, we already explained it. Okay. Can I tell my wife? Do I need to inform? So his concerns are basically, do I need to inform my employer? Your answer is, you don't need to. Could you just tell me what you do for a living? I am an accountant. No, you don't need to. Okay. Number two, doctor, can I have children? No, of course you can have children, John. Of course you can have children. There's nothing wrong with your fertility. That's the answer. Okay, I just want you all to know that when someone asks a question, please answer his question. I know it's a very basic thing to say, but the truth is that people tend to, they don't even answer the question. My question is, can I have children? See, HIV is a type of disease where, it's a sexually transmitted. Like what? I just asked one, just say yes or no. Yes, John, you can have children. Of course you can have children.
What
So you
if we
don't
don't
get,
know?
sorry, what's your question?
So what if we don't know the answer to his question?
So here's the deal, Seher. What did I tell you? You didn't hear it from me. It's a fixed. Okay. So, so these are the questions that he will always present with. You get what I'm saying?
Okay.
No one knows this. There's never a new question. It's always going to be these concerns. Whatever you're going to study, all the cases you're going to study, it's never going to be like some new randomly, because that simulator doesn't know what a concern is for HIV. He's not a doctor. So he's just going to be given a bunch of questions that everyone is given, that even you are given. And he's going to ask those. He's not going to just make up some crap like, doctor, so what about, like, can I dance while I'm in HIV? Like, he would never ask that, you know what I'm saying? Like, he'll never be creative. The simulator only does what he's told. He only follows the script. And the script is always like this.
Okay.
Script, patient information. This is the only script he'll get. That's it. These are the questions he need to ask. These are the script questions, okay? So this is how you read notes, and this is how you... So the main part about notes is go through the entire thing, read it. Don't memorize it. Read it. Don't memorize it. Follow my structure and practice this case with yourself. Put an 8-minute timer and try to complete it in 8 minutes. And then if the patient asks the depth of question, only then answer. This is what I'm trying. Don't give him extra information. For instance, I go to the parlor and I'm like, I have a question. Can I get silver hair? And then what if like there's a whole criteria that if you are working as a doctor, you cannot get silver hair, or because the silver hair interferes with you, with your patients, something like that. Okay. So I go to the hairdresser, doctor. So hairdresser, can I get silver hair? The hairdresser doesn't need to say, if you are a doctor, you can't get, bro, just be, the hairdresser will be like, what's your profession? I'm an engineer. Okay, then you can get silver hair. So keep it simple. That's what I'm trying to say. Like, why are you, if she's saying she's not a doc, like, you get what I'm saying? So it's like I don't care like if doctors can get silver hair, just tell me, can I get silver hair or not? Get it? So don't confuse it, don't over talk. No need to tell too much information. That's what I'm saying. No need to be over smart, no need to be too efficient. This is the problem in the exam. Majority are doing this, majority are screwing exam because they have this concept, I need to look like I know a lot. Okay, let me tell you, informing employer, let me tell you, if your profession has any like risk involved, like you transmitting, like maybe you're like a drug dealer or maybe you're like a prostitute, don't do that. Okay, don't give extra. Okay, keep it simple. This was just a way of me to explain to you. Don't if there's like some information, like you don't need to tell him everything. I know you know a lot. Keep some things to yourself. I know you know a lot, but you don't need to sit. Ceftriaxone 500 mg, 1 gram. He doesn't give a crap. Patient doesn't give a crap. Patient just wants to hear, are you treating me or not? Yes, I'm treating you. That's it. However, if this was an exam where an examiner is like, tell me, how will you treat STI? Then you will have to say, doctor, it's going to be IV 500 gram, blah, 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 ceftriaxone stat. But this
Dr.
exam is not.
Hasina, I just remembered my question. I always forget this question. So I'm just interrupting you at this moment. I just wanted to ask that is there any station where the examiner is going to ask us some questions?
Maximum 2 stations, maximum, and minimum 1 station. What is that minimum 1 station? Siman. Okay, once you've done the whole Siman case, because Siman is a mannequin, there is no human being involved over there. So the examiner is the only person over there. Possible that, okay, leave the Siman and come to me. Tell me, what did you do for the patient? In Siman cases, this happens. Some very few times, there's a case that says at the 2 minute mark, talk to the examiner. Very sometimes, you can say like 10% chances for a case where they tell you to talk. However, it's always with the patient.
Okay.
So I'm going to teach you guys, I'm going to do a little exercise with you because we're done with the sexual health. Woo, we've come to the end. But I'm going to do a little exercise with you guys to teach you something that I won't tell you what I'm trying to teach you. I'm going to check you all, okay? So, doctor, I have a question. Doctor, so this patient, she has a cyst on one side of her ovary. It's a cyst that needs to be removed via surgery. Once again, I'm repeating the scenario. Mary has a cyst on her ovary. It's about to be removed by surgery. Someone open their mic and I have a question for them. Mary has a cyst on her ovary, which is about to be surgeried and removed by the doctor. Someone open their mic. I think Arshi might know the answer to this. Her exam is close, I guess. Right, Arshi?
I don't, but let's see.
Okay, let's try. Doctor, I'm having my cyst removed. Can you just tell me, will I be able to have children?
Okay, so this is a unilateral cyst, right?
Yeah.
Yeah. So as long as the other ovary is intact, you should be able to have kids because the surgery will only remove one cyst.
So the point over here is I want you all to know that any question patient asks, you have the answer. It's very common sense. It's logic. They'll never ask you some MRCP question because patients they don't even know basic MBBS. Why can they ask you MRCP question? Okay. So don't be worried in front of patient. Be very confident. You have the answer to everything. What I want to compliment about Urshi is that she was able to answer my question in one line. And literally her answer was to the point. I have seen multiple people not answering my question, saying other things. That's okay. Someone open their mic. I have another question. Everyone's scared. Everyone's scared. I'm testing your explanations. I'm seeing how well you do with explanations. Honey, even if you do bad, I'll teach you guys it. You get what I'm saying? That's what I'm trying to assess. It's not like, how dare you do bad? You're a laughing lot. Laughing lot? What? Yeah, who's opening their mic?
Okay, even though I'm not good at this, but okay, fine.
There is like, you know what? I'm going to go in the battlefield. But that's good, right? The fact that you're not good and you're doing it, this is going to help you a lot. Okay. Seher, doctor, doctor, I have AIDS. I'm going to die. He's
I'm
HIV
not
positive.
good in this thing. I'm really not good in this thing. Dr. No?
Guys, listen to me. I'm going to teach you something. Get out of your comfort zone. That's it. The more difficult something is for you, go and put your face on it. Like, yeah, tell me what. Okay, I'm doing bad. But that's how you're going to get better at it. Okay?
Okay.
Doctor, I have AIDS. I'm going to die. Is that right?
Well, yes, you will.
Ah! Well done, Seher. You made us laugh. So if this was definitely a comedy exam, I think Seher is topping. Well done.
Okay, look, okay. Okay,
Go
let's start.
ahead.
All right, so I understand that, it's very scary to hear, but having AIDS, does not mean that you are going to die. Um, the good thing is that people with AIDS can also, live long and healthy lives if, they
Seher,
start
wait,
the
wait.
treatment.
Stop.
Okay, I did
He's
something wrong.
HIV positive. He's HIV positive. He's not AIDS positive. I just taught
Okay,
you the
he's
concept.
HIV. Yeah, yes. Okay.
Now
I
listen
thought
to
that.
what the patient is saying. Listen to the patient's question.
Okay.
Doctor, so I have AIDS. I'm going to die. Is that right? Go.
Oh, okay. Well, I understand that, it's very scary to hear, but the thing is that not all HIV people has, AIDS. You are only going to get AIDS if, you don't get the treatment. So I think that is it. No?
It is. Sir, when it's, oh,
Yeah.
your exam is in November. It's okay. You're still early. That's not bad.
And in
So
September.
September. I'm just
Yeah,
kidding.
I
Seher,
forgot.
but
I forgot my.
okay, but Seher, I want you to start working on your explanations. Although this was a good
Okay.
explanation, but I could see your fear. Just because you were having a fear, that's why, but then you did it right. You did good. Then why are
Okay.
you scared of it, right? So I want you all to develop confidence. First thing, his question said, I have AIDS, right? Answer is
Yeah.
no. That's it.
Yeah.
That's all I'm trying to say.
Yeah.
Say
Yeah.
no. Say, like, answer his question more directly rather than this is why I'm saying people indirectly answer. But patient doesn't have the
Uh,
brain to understand indirect.
yeah, I get it.
Okay? So they feel like,
Yeah.
oh, I'm very sorry you're feeling that way. I'm sorry you felt that way. No, you don't have AIDS. No, you're not going to die. Reassure. And no. Okay, doctor,
Yeah.
okay. Let me explain it to you. HIV, blah, 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 whatever you said.
Yeah. I get it.
Okay?
Like I should have said it, like first I should have said that no, you're wrong. Like you're not going to get this. And
Yes.
then explain it.
So literally, it should be like your little sister talking to you. Always go into the cubicle like it's your family person. Like, will I die? And obviously, the first thing to your sister, you say, "No, I love you." Right? You console them, you reassure them. So that's exactly
Yeah.
what you're going to do to the patient. Yeah, Aisha was
Yeah.
trying to unmute her mic. Go ahead, Aisha.
I was just going to explain this. Now it's done, I think.
Aisha, I'm going to give you a new question. Ready?
Okay.
A doctor, actually, the problem is that I don't want to lose my employment and. Doctor, will you be able to do something for me to like stay employed? Wait, I don't know what I'm saying. Doctor, doctor, since you're telling me I have anorexia, will I die from it?
No, you're not going to die from it. But like if it will not treat you like then it can be complicated. However, you're not going to die from it.
Okay, then what is anorexia, doctor?
Anorexia is basically I would say that it is psychological thing. Like you think that that you want to lose weight, although you think that you are obese, although in reality you are not, and you try different things like unhealthy ways to lose weight. So like
That's it. Lose
and
weight. Full stop. Full stop. That's what I'm
okay.
trying to teach you. The more you go like so, the more you'll stumble upon your word. I assure you, if Aisha went on with the so, she would have made a mistake then. So in the first breath, whatever you can say, that's enough. Try to speak that,
Okay.
and that's it.
Okay.
It's a type
Thank
of
you.
eating disorder that makes you do coping ways to try to lose weight. Try not to overspeak. The more you overspeak, the more you tend to mess it up. And then you're like, shoot, why did I say that? Shoot. So that's why they say tongue is a powerful weapon. Use it very wisely. So the less you speak, the better it is. Same thing applying to PLAB 2. One line, if it's an eating disorder that you think that you're overweight, and then you try to compensate by losing your weight. You stop there. If she asks more question, how do you lose weight? Like if she asks, then you give her the answer. You get what I'm saying? Be very smart. Don't
Oh
get
yeah,
off in
this
the
is very
first sentence.
important. You are telling this. Yeah,
Exactly. And
we need to
even if
learn this thing. Yeah.
well done, Aisha. So it's like basically train yourself to do that. These are important things. These are things that you want. Nobody will tell you these things. These are
Yeah, you're right.
psychological, conversational things. Second thing, the more you talk to her, your time goes. Isn't it better give her less information so your time doesn't go and she'll be like, okay, I get it, anorexia. Like she probably doesn't even want to know that much as you're telling her. You'll just tell her it's an eating disorder. Okay. Are you following me? Yes, doctor. She doesn't want to know more. Okay, I can move on to the treatment. That's lucky for me. So this is what I'm trying to say. Don't try to give too much knowledge. This is the misconception of people. They give more knowledge. But once again, the more knowledge you give, the more you're likely going to stumble upon yourself. So keep it easy. Keep it easy. This is smart. Being smart. The more you speak, the more you mess up. It's true. There's all psychology.
Very true. Yeah, very true.
Well done, Aisha. Well done, Arshi, and well done, Seher, for participating today. Brilliant participation by all of you. Asma also participated. I believe she's in the academy now. And everyone, I always encourage you to participate and get these training exercises that I do. They're conversational skills that I'm teaching you. It's good that you mess up here, so you learn, okay, I need to do this better next time. Okay. So learn that, and well done. We've come to the end of sexual transfer. Oh my God, we ended early today because you guys deserve this early treat. You guys have been so active since day one. You deserve to end early today. Have a good sleep, and I'll see you with the next. I think we have counseling cases. Whatever it is, we'll figure it out on Thursday. Tomorrow you have a class with Dr. Azram. So yeah, take good rest and get ready for tomorrow's class. And don't get discouraged. Don't get overwhelmed by the syllabus. Keep going. Consistency is everything. Okay, I have to say some words of it.
I have a question. Will we have a class on Friday because we have Eid on Friday,
Eid
like
is on
6th of
Friday?
June?
Isn't
And we
Eid
have
on?
Eid.
Like in Pakistan, it's on 7th, and otherwise all over it is
The
on
world is
6th.
sick.
All over the
Okay,
world is
if
6th.
it's Friday's Eid, then probably our mentor will not take the. But the mentor. So it's gonna
Because
be
it's
Eid.
scheduled.
Okay, normally we don't close for Eid because I don't know, because it's UK Academy. So for some reason we're not Muslim. You get what I'm saying? Not everyone's Muslim. Okay, I'm sorry. I'm sorry. Okay, so that's why I'm really rude. But like you get what I'm saying? So
I get your point.
yeah. However, if you guys want an off on Eid, do one thing, write in the registered members group. We won't like, is it off on Eid? No. We won't be able to make it on Eid. And then if many people say it, most likely mentor will be like, I'm not taking class. And we can do it later. If majority say, you get what I'm saying?
I'll write an emotional message.
Otherwise, the head says like, I don't want to give any explanation. I don't know how to do explanation. But for this, she's like, I will write a whole paragraph on this. Yeah, exactly. Yeah. Not everyone's Muslim. That's the answer. Not like that's so rude of me.
Yeah.
We are not. That's so rude. Okay, so we don't get offs. So anyway,
Right.
write it in the group, and most likely even the mentor was like, I don't wanna. The mentor is like Dr. Zobia that day. She's like, for Eid, I don't want to take class, right? So,
Mm.
but Eid for her is gonna be on 6. It's gonna be on
Yeah.
7. So
It's on
Yeah.
just
7
go and
Saturday.
tell her. Ask Zobia about it. Be like, Dr. Zobia, are we going to have class on Friday? That's about it. If she says yes, then
Dr.
tell her.
Azram, one
Yeah,
one
yeah.
question from you. I never asked. I asked Dr. Azram. It's
Yeah.
Azram, right? Yeah, I
Azram, yeah.
asked him this question, and I'm also going to ask you this question as well.
Okay.
You know, when did you pass your PLAB exam?
I passed it recently, like September 2024.
Okay, so I just wanted to ask, like how did you prepared? In how much time span?
Oh, took me 2.5 months, not more than that.
Okay, all
And it's
right.
normal. 2.5 months is a normal time. It's an average, like
Okay,
good time.
okay.
Like you, in 2.5 months, you had a dedicated study, or
And it wasn't dedicated. Let me tell you something about PLAB 2. You will never be able to be dedicated because this exam has nothing to do with studying, and like getting lost. No, it's a lot about conversation. So most of the times you'll just read and then you'll get bored and then you'll sometimes have a conversation. So it's not a dedicated studying. A dedicated studying would be the last 10 to 20 days is the time you'll actually be dedicated and worried about it. So even if you're not getting committed to the studying part in the first month, in the first 1.5 months, it's normal, very normal, because there's nothing much to memorize in this exam. That's the thing. So don't think you're stupid, or don't think that, oh my God, why am I not giving time to this exam? In the last 10 to 20 days is when you actually get focused. That's when you start getting
Mm.
like you're stressed out. And even then you can't do much about it because it's all about conversation and practice. So it's not like you being in your books all the time. Like, no, that's not going to happen. A very easy exam. Just keep practicing. Practicing is key. The more you're on the books, that's not good. The more you're speaking, good. That's good. You know what I'm saying?
Yeah, yeah. I totally understand your point.
Okay, guys, thank you all for attending today's class and being so entertaining, being so
Okay,
fun. Yeah, what?
okay, bye bye.
Bye. You guys are amazing because you guys are very interactive and participatory. I hope that's a word. You all are very active students. Well done, everyone. Okay, see you on Thursday.
Okay.
okay, bye.